This is the second edition of the free medical caravan held in the community of Damfakunda in the Tumana constituency through the Canada-based ZAWIYA Foundation in collaboration with the Ozone Health Charity Foundation in the Gambia. The free medical exercise is meant to provide accessible healthcare services to communities in Damfakunda and satellite villages. The scheme was facilitated by Imam Fode Drame, a native of the community based in Canada, who founded the ZAWIYA Foundation. Speaking to the head of the medical team, Dr. Usman Ali emotionally stated challenges faced in ensuring access to qualified healthcare, which he described as a fundamental right. Dr. Usman revealed that in many cases, diagnosis of condition in the community uncovers hypertension and diabetes that can easily kill or cause paralysis.
And we have seen a lot of the patients with a heart attack and their stroke because their diabetes or hypertension could have been taken care of. Simple, cheap medications. We brought thousands and thousands of the pill basically. And here I'm seeing young or old, everyone who could have taken these medications or even did something to prevent this disease, their blood pressure is all over the place. And I'm so concerned with that. Those simple things which could have been prevented by simple lifestyle or with simple medications, it's not there.
The president of the Ozone Health Charity Foundation, Alaji Drame, explained the causes of hypertension and diabetes, noting the lack of control over the types of food people eat. Mr. Drame advised people to limit salt and oil and embrace exercise as well as eating natural food, such as fruits, to keep their bodies healthier and prevent the rise of hypertension and other non-communicable diseases.
A lot of interesting cases, one of which is hypertension, diabetics, asthma, also some skin disorders. But most interesting is the diabetes and then the hypertensive cases which are rampant. Okay, so we are actually making all possible means in which we can lower the risk of complications of those conditions.
A member of the ZAWIYA Foundation who spoke on behalf of Imam Fode Drame expressed gratitude for the organization's efforts to deliver free health services to communities who find it difficult to access health facilities.
The kind of things that we often take for granted is deeply humbling. And it also shows just how much of a disparity there is in the world and how we have to do our part to help those who are in need. So it's an enormous joy. It's a cleansing experience. It's a little warmer here than we're used to, where we're coming from. But all of this, these are very, very small sacrifices to pay to be able to witness the miracles that are happening here.
The Imam of Damfakunda, Basalim Drame, thanked the medical team for what he described as a life-saving scheme for the community and satellite villages, advising people to control their diets.
I may say that because of we rapidly change our diet, that causes a lot of these health issues. So we should revise ourselves and our diets and foods to look at it. What we're supposed to eat, what we should not eat.
Masayo Drame and Lamin Suso, respectively, highlighted that the medicine received are very effective, saying the interventions have saved many people in Damfakunda from spending huge sum of monies to access health services. The Dua thanks the ZAWIYA Foundation and their partners for providing them with such an important lifesaver in the community. And along the journey, they are now supporting communities with different projects such as this structure, which the foundation is constructing in Damfakunda for their subsequent activities to be held after its completion. Seydou Kamara, reporting for Jatas News from Basse, Upper River Region.